Enterprise Health is currently available in 9 languages and is used in 48 U.S. states and in 53 countries around the world. Employees connect to the Enterprise Health Employee Portal using single sign-on. When they log into their workstation, it will authenticate their user ID and log them into the portal. From the portal, they can do things like schedule appointments and complete questionnaires that they're due for. The portal will list any pending appointments with a link to self-schedule. This shows available dates and times that may be selected to schedule the appointment. They may also select a different date to schedule using the calendar option. Once they have selected a date and time and submit, this will automatically block the time on their calendar in Outlook as a private appointment and does real-time scheduling on the clinical side. The appointment confirmation email will also include a link to any questionnaires that they're due for. That link will direct them back here to the portal to complete their questionnaire. Enterprise Health comes preloaded with 30 standard questionnaires, including all of the OSHA questionnaires. There is an editor that's built in for a system administrator to make any changes to questionnaires or add additional questionnaires to the system. Questionnaires also have the ability to pull forward how they previously answered questions, and we can also pull things in real time from the clinical chart, including immunizations, allergies, and medications. Questions have the ability to show or hide additional questions based on how they answer. If they said no to a question, they may not see any additional questions. However, if they said yes, then they would. We also have the ability to show or hide additional questions based on gender, job role, country, or any other type of information. The medication knowledge base within the system comes from First Data Bank, which is a national drug database, and that information gets automatically updated once a week. All of our drug interactions, contraindication alerts, and drug diagnosis alerts come from First Data Bank. When the employee makes a change to a medication, it is updated in real time on the clinical side. The portal also has the ability to do secure messaging with the clinic. The employee can click here and ask a clinical question. Once they submit, this will automatically task someone on the clinical side to review the question and respond back securely. Any documents may be shared with the employee. Things like lab results will show a copy of all of their labs with the ability to print. You can also share other types of documents like injections and audiogram results. The side menu of the employee portal offers additional modules and options for the employee. The employee has the ability to report a work injury or illness. This asks all of the questions about how the injury occurred and where it occurred. When they submit, this will automatically task someone on the clinic side to notify them that an incident's been reported, and all of this information pulls forward into the case. The employee has the ability to view work status reports. This shows their current surveillance status, next due date, as well as any restrictions or accommodations that they may have. Other health resources shows a listing of different websites, URLs, and forms that the employee may have access to. The Supervisor portal is available for supervisors to have access to view information on their employees. The supervisor also has a secure message center to message with the clinic, and they may view work status reports for all of their employees. This will show the most recent work status report, including their surveillance status, next due date, and any restrictions or accommodations. The supervisor also has the ability to search for a specific employee here. The Orders tab shows the supervisor a list of all of their employees, and if they have security access, they may select certain employees and request that they be added to different surveillance panels. Any orders that they have access to will display here, and they may select the order and request that it send out a notification to the employee or that they be scheduled for those services. The supervisor also has the ability to request a scheduled appointment on behalf of an employee. Here they can put in the details of the request, and when they submit, this will task someone on the clinic side to schedule the appointment. The support page gives contact information for the supervisor. Many customers also link out to any reports that they may want the supervisor to have access to here on the portal. Those reports may include a list of employees that have restrictions, a list of respirator wearers, and health surveillance status for all of their employees, including which programs that they're enrolled in, certification status, and next due date. When you first log into the clinical EHR, you default here to the Quick View dashboard. This screen shows you different sections, including a list of patients that are checked into the clinic, any tasks assigned to you, a clinic work list of visits that have not been closed out yet for the day, and allows you to search for a patient chart and see your schedule for the day. The user can select which sections they would like to see on the screen, and there are also defaults based on user role. The systems may be reconfigured by dragging and dropping, and the system will remember the order that you prefer to see them in. Once you click on a name to go into the patient chart, this takes you to the Summary tab. This is a patient dashboard that shows you all of the past medical history and documentation for the patient. Just like the Quick View tab, this screen also allows you to select which sections that you would like to see, and there are defaults based on role. You can also drag and drop and reorder these sections however you'd like. At the bottom, it shows the work status and includes links out to labs and other documentation. Across the top, these are all of the different chart tabs included in the system. The little numbers and brackets tell you how many documents are in that tab. The Email Log tab will show a listing of any emails that are generated from the system, including the date and time they were sent, who they were sent to, and whether or not anyone was CC'd on the email. The Admin tab also shows appointment history, as well as any document that was printed or faxed from the system, date and time, and who did it. There are tabs for case management. The Health Surveillance tab also shows panel membership overview, which includes a list of surveillance panels that the employee is part of, along with their certification status and next due date. It also shows their panel membership history, including start dates and end dates. There is a separate respirator information tab that shows which programs they're part of, as well as fit test results. The Medical Record tab shows all of the previous office visit notes, as well as past medical history. Test results shows any testing that they've had done. Enterprise Health does interface with a long list of different devices. For audiograms, these results came in directly from the device, and the system builds a flow sheet of all of their previous audiogram results. There is a comparison tool that's built in. This does identify if there was an STS and includes age and non-age corrected shift. It also allows you to modify the baseline and keeps a baseline history of any changes. This EKG came directly from a Welch Allyn device, and it puts the image side by side with the interpretation. Orders can go electronically to a lab, and we can receive the results back electronically within Enterprise Health. Any abnormal values are highlighted in red, and if you'd like to see previous results, you can click on the test name, and it does trending and shows you all of their previous results with a link out to that lab report. When results come into the system, there is an automated task that will notify someone to review the results. A copy of that task is stored here with the result, so if you ever wanted to go back and see who was notified, this will show you who completed the task and the date and time it was completed, as well as any notes associated with that review. Drug screen results can also come into the system, and those may be restricted, so only certain people have access to view the results. For PFT, you can choose the type of device and load directly from the device. You can also do manual entry. This shows a history of all of their previous results, and you can set one current and compare it to another result. At the top, this will calculate the difference and percent difference, and you can also do graphing. Vision results may be uploaded directly from the device, or you may do manual entry or scan in any types of these results. We also have a forms library. All of the customer's forms are loaded in here, and data is overlaid onto the form. Things like consent forms may be barcoded so that when they're scanned back in or if they're faxed into the system, we read the barcode and it automatically indexes into the chart. The barcode tells us the date of service, the name of the patient, the type of document, the location, and all of that information is automatically indexed. Any discrete data may be overlaid onto a form. That includes demographic data, employment data such as Supervisor, things like allergies, medications, last A1C result, or even incident case data can populate onto workers' comp forms. If you're using a tablet device, you can also use the pen option to pull the form up within the clinic and have the patient sign right on the form and click upload. You don't have to print the form to scan it back in. Forms may be completed online using a tablet. We also have bubble forms, which can capture data, things like audiograms, biometric data, EKGs, PFTs, vision, and chest x-ray results. The bubbles can be completed, and when they're scanned back in or faxed in, this information will automatically index into their chart, and the system does optical mark recognition to store all of this as discrete data, and the barcode tells us who the patient is and what type of document this is. These are just some examples of different types of forms that can be loaded into the system, and it also includes state-specific forms, things like doctor's first report, employer's first report, or workers' comp claim forms. There are also sketch templates that are built in if you'd like to sketch on a background image. This stores your drawing directly into the chart, and you can annotate as well. The system also integrates with Microsoft Word, so Word templates can be created within the system. This will launch Word, and it can pull in discrete data from the chart, including things like demographics, data service, allergies, medications, as well as the provider's signature and printed name. Once you type your note, you can click Upload, and this will upload into the chart, where then you can print or fax the documentation. It also includes spell check. Enterprise Health also includes a risk PACS. Any radiology images may be stored directly in the chart, side by side with the interpretation. Things like X-rays, CTs, MRIs, echoes, or ultrasounds may be stored within the record. There is also an enhanced viewer that's built into the product. You can do window leveling, contrast, and hanging protocols as well. Down the left side menu, these are all of the different modules of the system. The scheduler allows you to view the schedule for a specific provider, or you can view multiple provider schedules at once. You can continue adding as many different providers as you would like to view on the screen. And you can also save your preferences so the system will remember what order that you would like to see the schedule. The check-in module allows for manual check-in, or you may have a kiosk in the lobby where employees swipe their badge and it will check them in for their appointment. Once they are checked in, the system will start tracking how long they've been waiting. That displays here from the appointment. It also displays from the main quick view screen in the check-in section. And there is a separate check-in side menu tab that shows a list of patients that are in the waiting room and how long they've been waiting, as well as a list of patients that are waiting throughout the clinic. If they've been waiting longer than 15 minutes, this does turn red just to alert you. And it does keep real-time statistics at the bottom of your average time spent in the waiting room and your average time from check-in to check-out. Once you move them to an exam room, the system will start over and it will keep track of how long they've been waiting in that specific room. To go to their chart, click on their name. This will take you to the summary, where you can review all of their past medical history and recent visit notes. At the top, the system will automatically open the appropriate visit encounter based on their appointment type and reason for visit. The blue buttons at the top have a drop-down that show the different sections. By clicking on a section, the system will scroll and take you directly to that area to do data entry. The chief complaint for the appointment will automatically pull in from the appointment that was scheduled. It also shows the previous chief complaint off to the right. Protocol templates are built into the system and are based on the type of visit. The system comes preloaded with different nursing protocols. If a nurse is seeing the patient for the appointment, they can choose a protocol here, and the system will modify the questions throughout the visit encounter. This includes sections in the HPI that will collect different information about why they are being seen and prompt them to interview the patient and ask specific questions. It also includes a shortcut to documentation. So if they have any of the following symptoms, they can just select them here and it will pull that information into their documentation. They can also click in the box and type additional information or make any changes. This also affects the physical exam and the plan area, where depending on how they answer these questions, the system makes recommendations for over-the-counter medications that may be administered, different orders, patient education instructions, and follow-up. All of the protocol templates are configurable, and customers can modify those or create their own. This patient is here for a right ankle injury, so when I select occupational injury, you'll notice the HPI changes and asks specific questions related to the injury. The case section will show any previous cases associated with this patient. If this visit is related to an existing case, there is an option off to the right to link the visit to the case, or you may create a new case up above. Any field with a red asterisk is a required field. All of the information from the HPI up above does pull forward here into the case. You may still add additional information. If the injury or illness was reported from the portal, all of that information pulls here as well. The system also has the ability to interface with workers' comp carriers, We can send the claim information electronically and receive the determination back electronically as well. If this is a workers' comp claim, there are additional fields that display to capture that information. The nature of injury or illness dropdown is configurable, as well as the body part. All of the case information is outlined here, and will pull forward to any subsequent visits for this case or case management that's conducted. The case information also populates forms, such as the OSHA 301 form, and any doctor's first report, employer's first report, or state-specific forms. Next, we have all of the past medical history information. This pulls forward from visit to visit, and to edit any information, you can just click on the title. For things like medications, you can type in the brand name generic or any over-the-counter medications as well. This will show you the different strengths that medication is available in. For the review of systems, you may free text in any of these fields or use voice recognition. Off to the right, it shows information from the previous visit, and you can click on that to pull that into today's visit. There are also macros that can be used to document information for each system. These macros are configurable either system-wide or by user. For vitals, you may do manual entry or import from a device. For height, if you type 5'10", it will automatically convert it to inches for you. And when you type in a weight, the system will automatically calculate the BMI. If you enter something that's outside the target range, the system will prompt an alert and warn you if it's too high or too low. Previous vitals display at the bottom. This is a basic visual acuity, and it also shows previous vision results at the bottom. We also have a full vision screening as well. For the physical exam, you may also do free text entry, voice recognition, and we display previous information off to the right, as well as any macros for each section. This section can show or hide different systems based on the protocol template that's chosen up above. Tests and procedures are for in-house testing. If you would like to order a test, you can just start typing and it will bring up different tests that you can add to your exam. There's also a pick list that shows a list of all of your common in-house testing. And if you want to add on any testing, you can just select it from the list, and it'll add that section here within your visit to document those results. While he's here for an injury, if I'd like to administer a flu shot, I can complete that here within the visit and document the lot number, manufacturer, and expiration date. You can also document a VIS handout. And this does link out to the VIS website, which would open in a new tab if you want to print the most recent VIS handout or print it in another language. For the diagnosis, this will show previous health problems up above. If any of these are active for today's visit, you can change it to active here, or I can add a new diagnosis. You can start typing the name or description of the diagnosis, as well as the code. You can also do abbreviations as well. The incident summary pulls forward from up above, just to review and make any changes if necessary. If you do have an interface with workers' comp, it will automatically pull back the claim status and determination, as well as the claim number and adjuster information. For state-specific, there are additional state questions that will appear. Anything that's required does have a red asterisk. You may also print any state-specific forms from here as well. This will overlay any case data onto the form and populate all of those fields. For e-Prescribing, you can type in the name of the prescription here. This will bring up different strengths that medication is available in. There is also a drug guide that's built in. This will open in a new tab to give you more information about that medication, including contraindications, interactions, pregnancy precautions, as well as dosing guidelines. To just view dosage guidelines, you can click the dose button here, and it will bring up that information. The system remembers how you prescribe, so it will bring up common SIGs or frequencies in the dropdown, and each provider can have a library of the medications that they prescribe. When they choose a library item, it will automatically fill out all of these fields for them, and they can review and make any changes. REF is refills. This is to substitute or allow generic. An indication brings up the most common reasons that someone might take that particular medication. If you'd like to type a note to the pharmacist, this can be transmitted electronically through SureScripts directly to the pharmacy. For outside orders, you can type what you would like to order here, or you may use a pick list. For an imaging order, this would bring up a list of all of the different types of orders, and you can select from a list. At the top, there is also a referral database that may be used. So if you know who you're referring to, you can start typing it, and it will bring up that provider. Or you can use the advanced search, which does a proximity search by zip code and shows a listing of all of the providers by specialty. This will pull in the provider's name, address, phone number onto the printed order at the end of the visit. Any follow-up instructions can be indicated here. For restrictions and accommodations, there is a restriction type and a subtype. If I do a driving restriction, then it shows additional options for driving, as well as a free text comment field to type additional notes. You can link the restriction to a problem and indicate if it's a permanent restriction or put an end date for the restriction. Restrictions are linked to the ordering provider, as well as the case that you have open above. If they're being accommodated for the restriction, you can state how they're being accommodated here, as well as a free text details field to type any additional information. Restrictions can automatically email out to the supervisor, and they also print on the work status report at the end of the visit. The employee can take the report back to their supervisor, or the work status report may also be viewed from both the employee portal and the supervisor portal. If any charges are being billed to insurance or to a third party, they are captured here. Any procedures or injections that are done throughout the visit are calculated automatically, and you may also add additional coding at the bottom. This is tied to a fee schedule in the background, and you may also add modifiers for services. The system will show if they have any previous appointments scheduled, or you may schedule a new appointment here at the bottom. For patient education, we do have an interface with HealthWise. This will look at the diagnosis up above and recommend different patient education here that can be given to the employee. The HealthWise patient education integration is optional, and there are additional fees for setup and for the monthly license per provider. You may type in additional patient education that will print on the final report. At the end of the visit, you can archive and close. This creates a final document. This will display all of the documented information for the visit. There are also additional views that display select information for the employee. At the bottom, this will show a list of any prescriptions or orders for the visit. Here you can electronically transmit a prescription, or you can print or fax a prescription or order at the end of the visit. You would also check the patient out, and this stops the clock and checks them out on the check-in dashboard and on the scheduler. Going back to the schedule, it now shows that this particular employee is checked out. For health surveillance, there are a list of health surveillance panels that are part of the system. This is the background area where we set up the panels and all of those business rules for the panel actions as well as membership. For ocean noise, this lists all of the testing that would be done for someone that's part of this program. The testing can be set up to filter by age, gender, whether or not it's required or voluntary. You can have indication or contraindication rules for things like if they're a California employee, we do a titer, but if they're not a California employee, that's not required. So we can set up different business rules based on what state they're in, based on country, or any other type of criteria. You can state if this is for routine entry or exit, and the trigger for this particular test can be based on date of birth. The last time that they completed testing can be based on data hire. A specific point in time is mostly used for flu program, and prior action completed is used in bloodborne pathogen. So the system calculates when the second hepatitis B is due based on the completion date of the first. You can also set the frequency for how often they should have the testing done, how long it's valid for, as well as the grace period. We do keep a history of any revisions or changes to the panel actions. And there is a separate membership area to set up business rules to automate who should be included in this panel. You may also make exceptions to the business rule. So for example, you could have a membership rule that says all active employees that are part of this location and work in this building in these cost centers are automatically included, except for this person, and you can put a reason why. The system goes through and automatically calculates panel membership and who's due for testing every day. The system will set up a waiting list appointment and send out email notifications notifying employees that they're due for testing. Those notifications go out 60 days prior to the due date, and again, 45 days prior, 30 days prior, and 15 days prior until they schedule. Once they've scheduled their appointment, the system will automatically send an appointment reminder email as well, and continue to remind them if they have any questionnaires that need to be completed prior to their appointment. On the side menu, we also have a task list. This will show any items that need to be reviewed. There is a red alert that displays at the top of the screen notifying you if you have tasks or e-signs that require your attention. You may click on the alert to go to the work list and review that information. My task is a lab result that needs to be reviewed. This shows me the document, and at the bottom, I can sign and mark the task complete. The e-signature queue is typically used for the ordering physician. Documents are automatically routed for review, or you may manually send them for review or for co-signature. For mid-level providers, the system has the ability to automatically route documents to their supervising physician for review. The e-sign queue allows you to scroll through and review all of the documentation, and then at the bottom, sign those documents. There is also a Webscan module. Webscan allows for high-speed scanning and indexing of documentation. Using a scanner, you can scan in a batch of documents. When you open the batch, it shows all of your pages here, as well as the image of the page that you're displaying. There are options at the top to process barcodes. This will go through the entire batch and look for any barcodes on the documents. When it finds a barcode, it will automatically index all of these fields for you. If there are no barcodes, you can come here and manually index the information as well. All of the fields are an autocomplete field, so as you start typing, it will come up in the dropdown that you can select from. If there are any pending orders, they will display here. So if this is a result, you can link the result back to the order, and that will complete the order. As you index the page, you can move on to the next page. And if it's a multiple page form, you can link subsequent pages back to the initial page. If it's a multi-page form and it's barcoded, the system does that for you automatically. The Webscan module also will automatically detect any blank pages. So if you're scanning front and back, it'll detect all of the blank pages if there's nothing on the back side. When you've completed indexing, you can close and upload to chart. That will upload all of the documents into their medical chart. The Fax Manager will show you a list of anything that's been printed or faxed, including any errors, and this allows you to resend the information from here as well. For reports, there are different categories across the top. If you'd like to run a health surveillance report, you can fill in different filter fields, and you can even forecast into the future to look at status. This will show a list of results, and all of the reports have the ability to export to CSV, which opens in Excel. Here you can do additional filtering and sorting of the information. There are also pivot tables that are integrated into the reports. Pivot tables take all of the data elements and allow you to drag and drop and create your own reports. And all of these reports can also show in a graphical format. So if I wanted to see this as a bar chart, you can change that and it'll change how the report displays. You may also save reports as a template so that you can go back and run them again and again. And those saved reports can show from your Save side menu tab here on Reports, or you can save reports to a dashboard or to the portal for specific people to have access to. This is an example of a saved report on a dashboard. This shows the details that make up the report as well as filter fields, and then the results down below. By hovering over any of the content on the graph, you may also click and it'll take you into the details of that report. There are different categories for reports. For safety, we have all of our incident reports, OSHA logs, and Sharps log. All of those have various filter fields as well. Here you can complete all of the information and it will show the results down below. These are all of our standard visit reports. We have reports that are specific to audiograms and anyone with an STS that missed their follow-up appointment. You can have condition-based reports, immunization reports, flu shot reports, as well as PFTs, restrictions, drug screening, and vision reports. We also have case management and industrial hygiene reports as well, which are separate modules within the product. This is a high-level overview of the Enterprise Health product.